Although cell phones have been around for more than 30 years, Americans today are connecting to the internet on the go more than ever. According to the Pew Research Center studies, in 2011, only 35% of Americans had a smartphone. And now 77% have a smartphone and 95% own a cell phone of some kind. And in a recent health survey, 90% of those in the study used a digital health tool in 2017. For some patients, a trip to the hospital is a huge undertaking. Telehealth saves these patients and their caretakers the trip. And for one patient and his family, it has made the world of difference.
Hi, Amy. Tom Reed faced a life-changing diagnosis in 2015 after losing all movement below his neck. He has PLS, a rare disease similar to ALS. Telehealth is a perfect fit for him. Here's Tom's story.
Any problems at all with your speech, problems at all with your swallowing?
This is what Tom Reed's clinic visits look like.
Let me hear you say just a few phrases. Can you say pa, 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 pa?
In 2015, Tom was diagnosed with primary lateral sclerosis. The disease confines him to a wheelchair as a quadriplegic. Movement is difficult. A trip to Penn State Health, exhausting.
It was horrendous to go there. I mean, I wanted to take him because I knew that was the best place, that he would get the best treatment. But to actually get him dressed, get him ready, toileted, get him into the van, drive up there to Hershey, which I do not like driving very much anyway, and then I have to get him out of the van, up to the clinic, and then sit in a room for 3 or 4 hours.
Telehealth changed their lives.
It's a lot easier physically, for myself. Most importantly for my wife, here that has to, in our case, has to get me ready, and then get herself ready, and then load up in the van in the case of, like I said, inclement weather, to fight through that.
The goal of telemedicine really is to allow us to continue providing care to people on a one-to-one, face-to-face basis after they're not able to physically come to clinic, or if they don't have the resources to come to clinic on a regular basis.
Breathing tests.
Great. Let me ask you to push your tongue in your cheek.
Visual examinations. All of it done over the computer.
There's a lot that the doctor can detect, just over the, by just talking to me. A lot of it is, how's my speech sounding, can I move my cheeks and things like that you can see just as easily over the camera and through the microphone, as you can being right there.
What can we do to make things easier for them while providing them with a level of care that they need? And I think, how can we leverage technology in order to do that?
A welcome use of technology for Tom as a patient and many more patients to come.
Tom's wife says the technology is easy to use. She says even her grandchildren could master it. Of course, telehealth and these visits are just an option. Anyone who prefers a face-to-face visit can do that. Back to you.
Thanks, Christina. Now joining us is Tom's doctor, Dr. Zachary Simmons. We learned a little bit about Tom. He suffers from something similar to ALS. Can you explain to our viewers what ALS is?
Sure. Well, ALS is a progressive degenerative neurological disorder. It causes damage to nerve cells called motor neurons. The motor neurons provide power to our voluntary muscles. So people with ALS, unfortunately, gradually lose strength in their arms and legs, their speech and swallowing, and ultimately their breathing.
Because of that, because there's so many different symptoms and so many different things going on, do these patients see more than one specialist often?
So they often do. So when people come into our ALS clinic, they see one physician, but there are a number of other healthcare providers that they would see at the same visit. Typically, this would be our nurse, speech therapy and occupational therapy, physical therapy. They would usually see a social worker, also a mental health counselor. We have a pastoral care counselor and a respiratory therapist. So the goal of the clinic visit is that individuals can see many care providers at one setting to save them the burden of multiple trips.
How then is telehealth helping with that, like in Tom's case?
So I think that the challenge for most of our patients is both the travel and the length of the clinic visit. What we found a few years ago when we did a survey of patients with ALS is that what they liked about multidisciplinary clinic was the opportunity to see multiple healthcare providers with expertise in one setting. But what they found to be a challenge and a burden was the travel time and the travel distance, and also the length of the clinic visits, which can last for 3 to 4 hours.
Right.
What we're hoping to do with telemedicine is to provide the same level of care through the same providers, but to reduce the length of the clinic visit and make it less of a burden.
It's really interesting. And I mean, this is being used to care for folks with ALS, and you see that as a great benefit. Especially
Yes.
for Tom, who says it's the mobility that's really a problem.
Exactly. So what we really see is that we may be able to use telehealth in a couple of different ways. For those individuals who can't come into ALS clinic at all because of their strength or because of lack of resources, the visit from their home can literally substitute for the entire multidisciplinary visit. I think for other individuals who may be able to make the trip, but for whom it's a burden because of the length of the visit, we may be able to shorten the visit by having some of our team members communicate with them beforehand.
Oh, okay.
So, for example, they may have a telehealth visit with a nurse or a mental health counselor or somebody else whose visit doesn't necessarily require hands-on examination, and then their clinic visit as a result of that might be a shorter one.
And Tom and his wife, they seemed very happy with this. What do you hear from other patients?
Right, so we've been using an older version of telehealth for about 3 years now with a limited number of patients, and we have queried them about what they thought about telehealth. How did it work for them? Because if it doesn't work for them, then there's no point. The whole point of
Right.
this is for the patients. So what we found is that most of them who used it reported that yes, it was a really good thing. They found that it was as good as an in-clinic visit for them, but with reducing the burden of the visit and the travel and the length of time, and that they would use it again. So far the response has been very positive.
That is so interesting. Well, thank you so much for sharing it with us, sir. As part of this special Good Day PA, ABC 27 and Penn State Health are hosting a web chat right now. Deborah Pinkerton is here to share some of the questions we've received so far. Deborah.
Thanks, Amy. Specialists are answering your questions right now at abc27.com/telehealthchat. Joining us right now is Susan Walsh, the coordinator for patient care services at the Hershey ALS Clinic. Thanks for being here. Susan, here's one of the viewer questions we've received so far. I often help my neighbor who has ALS. I think telehealth would be good for her, but neither one of us are good with technology. Does Penn State Health have someone that can come out to our house to set it up?
We don't have someone that could come to your home. However, we do have a team member who will contact the patient and the family prior to the visit, make sure they're absolutely comfortable with signing on to the program. During their clinic visit, this person is available, so if there are any concerns or problems with the technology, they will be able to connect with them by phone, and they walk them through the problems.
So they walk you straight through the
Straight
process.
through.
Great, thanks, Susan. And you can join the web chat right now. Go to abc27.com/telehealthchat to send in your question. Back to you, Amy.
Thanks, Deborah. We'll check back with you in just a bit. Now, telehealth isn't just for patients at home. Coming up next, we'll see how Penn State Health is using telehealth technology to help critical care patients. That's up next here on the special Good Day PA on ABC 27.